Good morning, everyone. I'm Francesco Martinetti from the Giada Martinetti Dental Studio in Moncalieri in the province of Turin. And today I have the pleasure of sharing with you a topic that we see every day, or almost every day. In the office, we deal with problems related to the jaw or pain when closing the mouth and in the joint, especially in adult patients. Patients usually come to us. This is the case with Giada, a young woman who came to us and was having trouble opening her mouth and was in pain. In this area here, the cheeks in front of the ear, especially Giada in the morning when she woke up, had difficulty even chewing. In these cases, we don't just focus on the teeth or on chewing, but we also fill out a chart. This is called a natological chart, which is a dental exam, but it also includes a general examination of the joints, muscles, and movements. And it also includes a medical history to check for certain, let's say, conditions the patient may have. And as you can see, this is the photo phase where we focus on the occlusion. However, we know that in these cases where there is pain in the joint or muscles, occlusion does matter. But according to scientific literature, it has been shown that in a smaller percentage, a large part of joint pain, especially in the muscles, though every diagnosis is unique, it is largely due to the forces we exert on our teeth and joints, these forces that we apply. Most of these originate from the central nervous system, so especially during times when someone is more tense or stressed, they tend to overload. They end up overloading the muscles a lot, here and here. And it especially overloads the muscles in the cervical area as well. And you see, we need to work not only on the teeth themselves, but we also need to comprehensively address the fundamental root of the problem, which is the significant forces we consistently exert on our teeth and joints. Once the problem is understood, you first work on resolving it by focusing on the joints and muscles, using exercises, self-relaxation exercises, physiotherapy exercises to properly relieve the joints and muscles. Then you proceed with additional tests to take a closer look. Specifically, we see that Giada had this deep bite with an initial contact already involving the incisors. They would wear down and close earlier, with the incisors touching first and then sliding back, which put even more strain on the joints. In her case, as you can see, this is the first point of contact. And then, to fully close, she would slide back to try to achieve the greatest number of contacts. Both on the right, as you can see, and on the left. And this made it even more pronounced. Instead, occlusal problems are, let's say, a lesser cause. So first, it's the forces that we exert on the teeth. And there are some occlusal conditions that predispose to these factors, such as a deep bite, as in her case. Crossbite, open bite, or those who have lost many back and posterior teeth, all of these are reasons for overloading the joint and the muscles involved in closing the bite. What's important before saying that it's the teeth causing the problems? We need to do an examination and understand the forces being exerted. So, when does one overload the joint and the muscles? When you clench your teeth a lot during the day, so you stay like this all day long. And you don't even notice it during the day, so it's clenching. This app that we have people download is called Bruxism. Let's say it's a kind of reminder, something you use to really understand if your teeth are in contact a lot during the day. Usually during the day, your teeth should be about 1.5 to 2 millimeters apart at rest, so that the joints and muscles aren't overloaded. If we keep our teeth in contact, thank you. All day long, the muscles and joints are under tension, to the point where they just can't take it anymore. And that's when this pain or locking when opening appears. So please, first, make sure during the day not to use your teeth. Second, at night, all of us, some more, some less, tend to grind our teeth. Bruxism means grinding your teeth. These are short but very intense episodes where we rub our teeth together and overload the joints. Why do we do this? Because our mouth is not just for chewing or smiling, but it also acts as a kind of valve to release stress and emotions. So bruxism is not a disease, but actually something good, because everything we accumulate during the day needs to be released. At night, of course, this is true only within certain limits, beyond a certain threshold. we end up overloading again. Not just during the day, but also at night, the muscles are affected. And so we use this nighttime test called Bruxism. It's a kind of Holter monitor you wear at night, where 2 electrodes are attached to these muscles here that are used for clenching your teeth. And there's also a heart rate band, because it's been observed that bruxism isn't just the contraction of these muscles, but it's actually preceded by an increase in heart rate. And as we can see from this patient's test, you can see that the bruxism indicator is 7.6. So it's said that someone has bruxism when the bruxism indicator is greater than 2. This means that at night she releases a huge amount of force. Do you see? As shown in this graph, every time the heart rate increases, there is a contraction of the muscle. Masseter, right side, and masseter, left side. And so this little device records them. So it tells us how much we clench our teeth at night, with what intensity and for how long, when someone has a bruxism indicator greater than 2. What we recommend is to use a bite at night to help better dissipate the forces. In some cases, we also prescribe an MRI scan. To get a good look at the disc, we have a cushion, like in the knee, that sits between the 2 bone ends to see if it has shifted forward. And if there are noises, clicks, or joint locks, we check where it is positioned and whether there is any inflammation or fluid buildup in the joints. You see, in this case, since she was putting a lot of force on her jaw at night, she had this, let's say, occlusal instability, where she had an initial contact and then her jaw would slide back. We fitted a bite splint on the lower arch for her to wear at night, to help relieve the muscles and joints as much as possible. During the day, however, she needs to wear the bite splint herself to avoid clenching and to become aware that teeth should not be clenched. They should only touch or barely graze each other for a few minutes a day when we speak, when we swallow or chew, and so the symptoms have disappeared. There was this deep bite. Clearly, we first worked on the diagnosis, on the muscles and the joint, on relaxation, and on the forces that she needs to release. Once they are relaxed, then the teeth can be moved, but moving the teeth is both for chewing purposes and for alignment, aesthetics, and the smile. We don't move the teeth to solve the joint overload. So first, we work on the joint, and then afterwards we can decide whether or not to move the teeth. The teeth. I hope I was helpful to you. If you have any questions, feel free to contact us. I wish you a good day.